Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, the children can pick up a viral infections such as cold and flu more easily than adults. Well, this is because their immune system is still developing and the common cold is one of the most common illnesses in children. So, to discuss on this, we are being joined today by Dr. Prakitish Bora, Pediatrician from Excel Care Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Dr. Prakitish Bora, for coming to Good Life, the health show. So, common illnesses is seen or viral illnesses seen in children in winter season. So, if we talk about what are the viral diseases that is commonly seen in winter season, so what would be that?
Yeah, thank you, Puja. Actually, the term common cold has been correctly coined because it is so common that it is the commonest kind of viral infection that a child can get, and it is more often seen in, although it can happen any time in the year, but it is more often seen in the winters because winters there is a crowding of people is more, people like to snuggle around, and the virus transmissibility becomes easier because of the change in weather, and the virus becomes more active during this period, and children are targeted because, as you said, correctly said, that children's immune system is being developed, is in a phase of development, so it is not completely the immunity level is not as good as an adult. So that is the reason common cold will strike children more often. Now, when you come to common cold, there is absolutely nothing to worry, and it is sometimes very difficult to differentiate whether a child is having common cold or some other more serious viral infections like flu. But it is easily differentiable if we keep certain points in our mind, that fever is not a very severe manifestation in common cold. You get more of nasal symptoms like stuffy nose, then running nose, sneezing. If the nasal symptoms are too much and child is has more difficulty because of the nasal symptoms, and the fever and other coughing and all that is not so much, then it is usually likely to be common cold. So the common viral infections, it is very difficult to identify the virus, as it is the test of identifying the virus is cumbersome and expensive. So mostly it is that these symptoms are always treated on the basis of clinical judgment. So for people to know when you think this is a common cold is when you have too much of nasal symptoms and coughing and fever thing is not so much. So you don't really require too much of medications for common cold. So what you need to do is use a saline drop nasal to keep the nasal symptoms away. And for a small child, if the nose is clogged, you can use a mucus sucker or a secretion or a sucking machine to use to clear the nose. And in extreme cases, we do give some medications to control the sneezing and the stuffy nose part. But usually those are also avoided. And the child should be given lukewarm water to drink, and moisture, air vapor can help in children in releasing the nasal congestion as well as if he has congestion down in the throat. So these are homemade remedies which can help. Some people do use some honey also with warm water, which can help, especially if there is too much of coughing. So besides this, the child requires a healthy food, a healthy diet, and some amount of rest. So this is all you need to do in a child who has common cold.
All right. Doctor, we are talking about children, we are talking about infants. So it is actually a very challenging job for the parents out there because they have to understand what exactly the children is or the child or the infant is going through. So if it is, we are talking about the nasal blockage, and you have mentioned about some nasal drops as well. So these are safe as per the medication, but depending on the parents, like how they can use it with the children. Is it difficult to handle these with children when we are talking about infants and children, because they won't easily allow you to give?
Yeah. That's an important question you have asked. Although we prescribe nasal clearing solutions to parents, many times they are not being able to use it, especially in a child who is a toddler. Say
Absolutely. The amount which you give, but maybe while giving 2-3 drops fall down here and there.
Yeah, exactly. So 1 to 3 years, this is a time when it is very difficult to administer medicines orally or locally in a child. So the parents will have to, like, what they can do is they can demonstrate that it does not hurt by applying onto their own, because we are giving saline solutions mostly, which is not medicated, so it is not harmful.
Okay.
It only helps to clear the mucus.
Okay, so in an activity way they can just
So
show
they
their
can just
children.
show it. Then I'll put in mama. Mama is not.
Or maybe some toy of the
or
child.
maybe some toy also. So when you demonstrate it in some other person, and then try to use it in them, then it becomes easier. But some children, whatever you might do, they will not agree. So in those cases, we may have to restrain the child while using it.
Okay.
And many parents, wouldn't like to do that, and they can't do it, restraining the child and using the saline drop. So in those cases, it is sometimes very difficult to manage. But one need not worry, because it's a temporary thing.
Okay.
Temporary thing.
It will take its own time.
Yeah. So what you can do is clean the nose from outside, whatever is possible, but without really rubbing the nose, because if you rub the nose, then the skin gets damaged, and there might be rawness in the nose, or ulcers might form. So one should always dab and clean.
Okay, okay.
Dabbing is, and with a wet tissue, you can dab and clean the nasal secretions.
Because it might form a dryness kind of form.
Exactly.
So, okay.
So wet tissue is always
Wet
advisable.
tissue is always advisable. So, doctor, if we talk about the viral infections, if a child is suffering from, so how long does a viral infection stays in babies? Does it have a period of time?
See, all viruses are not same.
Okay.
So it will definitely vary from what virus you are having. And what kind of illness you have. So suppose you have flu. A mild flu will be like common cold only. It will be there for about 3 to 5 days at the most. But sometimes it can extend up to 7 days. I think no virus usually, the common viruses I mean, will extend beyond a period of 7 days. So in our college days, we used to have a quote in our textbook that if you treat common cold, it will get well in 7 days. If you do not treat, it will get well in 1 week. So it is basically the same thing whether you treat or you do not treat. But that is the period, 7 days max, at max. But suppose the flu leads to pneumonia, complications of minor flu.
Okay.
You can have pneumonia, and that might become a major thing, and it may take several days to become okay. Because the pneumonia, when you have flu leading to pneumonia, you don't really have antibiotics or anything working against that. So it is very difficult to treat pneumonia when a child has pneumonia out of flu.
Okay, okay.
So if you have complications, then the period might extend. But as a rule of thumb, you can know that 7 days is the period where most of the viral infections will get well.
All right, doctor, we will be discussing at this point in time, but just I would like to tell our viewers that our numbers are flashed on your television screen. So if you have any queries regarding your children, your newborn babies, so Dr. Prakitish Bora is with us at this point in time, and please call up. The numbers are flashed on your television screens. Call up and ask your queries, and possibly doctor will give you all the answers. All right, doctor, coming back to you again, we are talking about pneumonia. So this is a period of COVID-19 which is still on, and we have to be very careful, and also when it comes to children. Now this new variant Omicron has come up, so parents are really concerned about that. Is COVID's Omicron variant impacting children? Will it impact children as well? So as a pediatrician, what would you like to say?
See, we have seen that COVID has always been a mild disease in children. So I'm not really worried about Omicron.
Okay.
But the initial reports that we had about Omicron was, since it has almost 32 mutations, so many mutations going on, especially on the spike protein. So people thought that, it's probably a virus of concern, but now many of people are saying that, labeling it as a virus of concern has been too drastic.
All right. Doctor, we'll come to this discussion, but we have a caller at this point in time. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় স্যাৰ নমস্কাৰ মই ছাৰৰ পৰা এটা কথা জানিব বিচাৰিছিলোঁ
নমস্কাৰ কওক
হয় মই আমাৰ মোৰ ৰিলেটিভ ভাগিন এজনী হৈছে আজি প্ৰায় তেওঁৰ 6 months মান হ'ল তেখেতৰ তাই বৰ্তমান অলপ প্ৰব্লেমটো হয় কাহ চৰ্দিটো বহুদিনৰ পৰা মানে তাইৰ জন্মৰ পৰা ধৰক আছে এইটো বস্তু আৰু সেইখিনি বস্তু নোহোৱা বা গৰম বৰ্তমান ঠাণ্ডাও পৰিছে মাজতে গৰমো হয় সেইটো কাৰণে তেওঁ যিখিনি নিৰাপত্তা দিব লাগে কাপোৰ কানিৰে ধুনীয়াকৈ ৰখা হয় তাৰ পিছতো মানে এতিয়ালৈকে মানে ভাল হোৱা নাই মেডিচিনে তেনেকুৱা ধৰণৰ লোৱা হৈছে তো তেনেকৈ আপোনাৰ পৰা কিবা তেনেকুৱা চলিউশ্যন পাম নেকি যিটো ক্ষেত্ৰত আমি আৰু অধিকভাৱে ভালকৈ ৰাখিব পৰা যায় যাতে ঠাণ্ডা নপৰাকৈ বা অতি সোনকালে মানে এইখিনি বস্তু ক্লিয়াৰ হয় মানে জ্বৰ চৰ্দি এই দুটা বস্তুৰ কাৰণে হয়তো ইভিনিং টাইমত বেচিকেলি ইভিনিং টাইমত বহুত বেছি কান্দে তো আৰু তাই ঠাণ্ডা টাইমটো সেই ইভিনিং টাইমতে হয় তো কিহৰ কাৰণে এইটো বস্তু তেনেকুৱা হয় কিবা আপুনি চলিউশ্যন এটা দিব পাৰিব নেকি
আপুনি কৈছে যে ছমহীয়া শিশু কাটি গ'ল নেকি অ'কে আপুনি কৈছে যে ছমহীয়া শিশু বহু দিনৰ পৰা কাহ চৰ্দি জ্বৰ হৈ আছে জ্বৰটো কিমান দিন হ'ল বাৰু
জ্বৰ তেনেকে নহয় ছাৰ মাজতে কমি যায় কাহ চৰ্দিটো অলপমান থাকে বা কেতিয়াবা নাকৰ অলপ শব্দও হয় যেতিয়া উশাহটো অলপ প্ৰব্লেম হৈ পৰে বা নাকটো বন্ধ হৈ থাকে তেনেকে
কিমান দিনৰ পৰা হৈ আছে এইটো বস্তু
এতিয়া ধৰক তাইৰ 6 months হ'ব বাট মাজে মাজে হয় আৰু নোহোৱা হয় তেনেকুৱা ধৰণৰ একজেক্ট মই কেতিয়াৰ পৰা হৈছে এইটো ক'ব নোৱাৰিম কিন্তু বেছিকেলি বৰ্তমান তাই ষ্টাৰ্টিং হয় মানে এইটো চলি আছে মাজতে এতিয়া অলপ কমিছে বাট চলি থাকে আপোনাৰ হৈ থাকে
ছাৰ মই ভাবোঁ যে আপুনি ইমান চিন্তিত হোৱাৰ প্ৰয়োজন নাই কিয় সৰু শিশুবিলাক যে স্পেচিয়েলি 6 মাহলৈকে 9 মাহলৈকে তেওঁলোকৰ নাকৰ যোনটো মিউকাছ জমা হয় সব শিশুৰে সেই বস্তুটো এইটো বয়সত অলপ বেছিকৈ হয় আৰু বেছিকৈ হোৱাৰ ফলত কি হয় আমাৰ নাকটো ব্লক হোৱাৰ নিচিনা হয় আৰু নাকটো ব্লক থাকিলে এটা সুৰসুৰণি হয় কাৰণে হাঁচি মাৰে গতিকে এই বস্তুটো নতুন নিউবৰ্ণ বেবীৰ ক্ষেত্ৰতো বহুতেই কমন কিন্তু এই বস্তুটো আপ টু 6-9 মান্থছলৈকে বহুতৰ বেছিকৈ থাকে যদি বস্তুটো অকল চৰ্দি ভাৱটো আৰু হাঁচি আহিছে তেতিয়াহ'লেতো আপুনি কোনো ধৰণৰ চিন্তা কৰাৰ প্ৰয়োজন নাই খালি এটা কথা মনত ৰাখিব যে যোনবিলাক অলপ আগতে আমি পাতি আছিলোঁ চেলাইন ড্ৰপৰ কথা সহজতে পাব আপুনি বিভিন্ন ধৰণৰ চেলাইন ড্ৰপ যেনেকৈ চলভিন বুলি এটা আছে তাৰপিছত আপোনাৰ মেক্সট্ৰা বুলি আছে অট্ৰিভিন আছে নেজিভাইন আছে বিভিন্ন ধৰণৰ চেলাইন সলিউশ্যন আপুনি ফাৰ্মাচীত সহজতে পাব সেনেকুৱা দি পেলাই নাকটো চাফা ৰাখিবলৈ যত্ন কৰিব নাকটো আপুনি কপাহ খলিতাৰ নিচিনাকৈ পকাই নেজেল ড্ৰপটো দিয়াৰ পিছত চাফা কৰিব পাৰে বা নহ'লে আজিকালি সাকচন বাল্ব পায় সেই বাল্ব দি আপুনি চাফা কৰি ৰাখিব পাৰে আৰু যদি খুব বেছিকৈ অসুবিধা হৈছে কেতিয়াবা আমি শ্বৰ্ট কোৰ্চ অলপ দিনৰ কাৰণে 5 দিন 6 দিন মানৰ কাৰণে কিছুমান মেডিচিনো খাবলৈ দিওঁ যদি খুব অশান্তি হৈছে তেতিয়াহে আৰু যদি বেছিকৈ কাহি আছে যে দিনটোত একেলেঠাৰিয়ে বহুতবাৰ কাহে বা ৰাতি কাহটো বাঢ়ি গৈছে তেনেকুৱা হ'লে কিন্তু নোচোৱাকৈ কথাটো ক'বলৈ দিগদাৰী হ'ব কাৰণ কিছুমানৰ এলাৰ্জিক কিছুমান কাহ চৰ্দি যোনবিলাক সাধাৰণতে আমি একদম সৰু অৱস্থাত দেখা নাপাওঁ ইউজুৱেলি 9 মাহৰ পিছতে দেখা যায় কিন্তু কিছুমান শিশুৰ ক্ষেত্ৰত সেই তেনেকুৱা ধৰণৰ কাহ য'ত আমাৰ ভিতৰত হাওঁফাওঁৰ ভিতৰত ব্ৰংকোস্প্যাজম হয় সেই কাহটো সোনকালেই আৰম্ভ হ'ব পাৰে কিন্তু সেইটো আমি যন্ত্ৰ দি নোচোৱাকৈ আপোনাক টেলিভিছনৰ দ্বাৰা কথাটো কোৱাটো দিগদাৰী হ'ব গতিকে আপুনি এইটো কথা চাই লওক যে কাহৰ পৰিমাণ বেছি নে নাকৰ চৰ্দিৰ পৰিমাণ বেছি যদি চৰ্দিটো প্ৰায় অসুবিধা হৈ আছে তেতিয়াহ'লে আপুনি চিন্তিত নহ'ব খালি যোনখিনি কথা ক'লোঁ মই সেইখিনি মানি চলক কিন্তু যদি কাহ বেছিকৈ আছে তেতিয়াহ'লে আপুনি ডক্টৰক দেখুৱাটো উচিত
All right. Thank you so much for calling at this point in time. Viewers, all right. Doctor will proceed with the conversation, but right now we'll have to slip into a short break, viewers. But do come back soon because we have lots more on the other side. Welcome back, viewers. You are still watching A Good Life, the health show with me, Puja, and we are having a fruitful discussion with Dr. Prakitish Bora. All right, Doctor, we were talking about Omicron threat in children. So what do you have to say on that?
Yeah, as I was mentioning, COVID as such has been a mild disease in children unless your child has some kind of underlying disease. So in my opinion, although we are concerned that Omicron has had so many mutations, about 32 mutations which has never been seen in any other variant of COVID. So the Delta variant, which was so severe in our country, all over world, had only about 2 mutations.
Okay.
So because these mutations were all in the spike protein, so it was alarmed that probably this virus will be very infectious, which is probably true, and fatal also. But now the limited experience that we have had with Omicron, the reports that I have seen through, from especially from South Africa, and most of the authorities have said we don't really need to worry about Omicron as of now, because since the data and the knowledge about Omicron is still growing,
Okay.
will only come to know with time.
No, with time.
But two things most people are saying is, one is we don't really need to worry about Omicron,
Okay.
In regard to its severity,
Okay. Okay.
or mortality.
Acha.
Probably Omicron is less severe than the Delta variant.
Okay.
That is what the opinion is so far. But about the transmissibility, I mean the ability to transmit, might be more than Delta variant. So again, that is absolutely not a sure information that we have as of today. So when it comes to Omicron in children, I don't think Omicron is going to be a very disastrous kind of disease when it comes to children.
But we have to take those necessary precautions we have been taking.
Absolutely, we should not take Omicron lightly, but at the same time we should not panic.
Absolutely, we should not panic. Doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello.
আমি শুনি আছো, আপোনাৰ প্ৰশ্নটো কৰিব।
মোৰ মানে 4 বছৰীয়া ল'ৰাটোৰ কোভিড হৈ গৈছে। এতিয়া মানে পোষ্ট কোভিড কেয়াৰৰ কাৰণে কি কৰিব পাৰোঁ? মানে কিবা সাপ্লিমেন্ট এনেকুৱা দিব পাৰোঁ নেকি, ভিটামিন বা আৰু অন্য কিবা এনেকুৱা সাপ্লিমেন্ট দিলে?
কোভিড হোৱা কিমান দিন হ'ল?
তাৰ অক্টোবৰত হৈছিলে। এতিয়া 1.5 মাহ মান হৈ গৈছে, কিন্তু মানে তাৰ এতিয়াও অকণমান প্ৰব্লেম আছে, তাৰমানে উইকনেছটো আছে, আৰু তাৰ মানে গোটেইখিনি চিমটমছ আছিলে, সেইকাৰণে তাৰমানে বেছি উইক হৈ গৈছে। এতিয়া তাৰমানে কেনেকুৱা ধৰণৰ কেয়াৰ ল'লে ভাল হ'ব? মানে তাৰ মানে খোৱা, তাক প্ৰটিনটো বন্ধ কৰি দিয়া হৈছিলে, তাৰমানে এতিয়া মানে
কি বন্ধ কৰিছে?
প্ৰটিন মানে
প্ৰটিন বন্ধ কৰিছে।
মিল্ক প্ৰডাক্ট সেইবোৰ একেবাৰে মানে বন্ধ কৰি দিছিলে ডক্টৰে। এতিয়া মানে কেনেকুৱা ধৰণৰ মানে তাৰ সলনি কিবা দিব পাৰোঁ নেকি তাৰ মানে বেলেগ?
নহয়, প্ৰটিন বন্ধ কৰা আচলতে প্ৰয়োজন নাছিলে। তাৰমানে কিয়, যিকোনো ভাইৰেল ফিভাৰ, এইটো কোভিড বুলিয়ে নহয়, যিকোনো ভাইৰেল ফিভাৰত আচলতে আমাৰ খাদ্যটো খুব ভাল হোৱাটো উচিত। কাৰণ আপোনাৰ শৰীৰত এটা বস্তুৱে এটেক কৰিছে, আপোনাৰ শৰীৰটো দুৰ্বল হৈ গৈছে ফলত। গতিকে সেই দুৰ্বল শৰীৰটোত যদি আপুনি খোৱাটো বন্ধ কৰি দিয়ে, তেতিয়াতো সেইটোৰ পৰা ক্ষতিহে হ'ব। গতিকে সেইটো প্ৰটিন বুলিয়ে নহয়, চব ধৰণৰ খাদ্যৰ যোনখিনি আমাৰ পুষ্টিৰ প্ৰয়োজন, যেনে কাৰ্বহাইড্ৰেট, প্ৰটিন, ফেট, ভিটামিনছ, মিনাৰেল, চবখিনি আচলতে বেছি পৰিমাণতহে এই মুহূৰ্তত দৰকাৰ। এতিয়া আপুনি কৈ আছে যে আপোনাৰ হৈ গ'ল অলৰেডি 1.5 মাহ হৈছে, গতিকে মই নাভাবোঁ যে আৰু কোভিডৰ কোনো ধৰণৰ শিশুটিৰ ওপৰত মানে অসুবিধা এই মুহূৰ্তত আছে। কিন্তু কোভিডৰ পৰা আকৌ বাচিবৰ কাৰণে বা অন্য এতিয়া যোনবিলাক ঠাণ্ডাৰ কাৰণে ভাইৰেল ইনফেকশ্যন হ'ব, সেইবিলাকৰ পৰা বাচিবৰ কাৰণে শিশুটিৰ যোনটো পুষ্টি সেইটো আপুনি ভালকৈ ৰাখিব, খোৱা বোৱাৰ যত্ন ল'ব, চব ধৰণৰ বস্তু যি আপোনালোকে ঘৰত খায় সেইবিলাক খুৱাব। আৰু আমাৰ অসমীয়া মানুহৰ খাদ্যত কিছুমান বস্তুৰ অলপমান নাটনি থাকে। সেইটো বস্তু মই কওঁ যে আমি প্ৰটিনৰ পৰিমাণটো আমি কমকৈ খাওঁ। যদি আপোনালোকে আমিষ খায়, তেতিয়াহ'লে ডিম সদায় দিব পাৰে, ডিমটো খুব ভাল এটা প্ৰটিন। মাছ সদায় দিব পাৰে, আৰু আমি যি মুৰ্গী বা চিকেন বা মাটন এইবিলাক খাওঁ, সেইবিলাক যেনেকৈ খাইছোঁ, যেতিয়া খাইছোঁ দিব। আৰু ভেজিটেবল প্ৰটিনৰ ভিতৰত আপুনি দালিবিলাক ভাল, চব ধৰণৰ দালি, ৰাজমাহ, লবিয়া, এনেকুৱা ধৰণৰ বস্তুবিলাকো খাব পাৰে। চয়াবিন দিব পাৰে, আৰু গাখীৰ আমি যোনটো সদায় খাওঁ, গাখীৰ অলপ খালে তাৰ পৰাও প্ৰটিন কিছু আহে। আৰু আমাৰ ডেফিচিয়েঞ্চি হয় ভিটামিনছ আৰু মিনাৰেলছবিলাকৰ পৰা বা ট্ৰেছ এলিমেণ্টছবিলাকৰ ওপৰত। সেইবিলাক আমি সাধাৰণতে শাক পাচলি আৰু ফল মূলৰ পৰা পাওঁ। গতিকে প্ৰচুৰ পৰিমাণত শাক পাচলি আৰু পকা ফল মূল স্পেচিয়েলি আমাৰ শিশুটিক খুৱাব লাগে। আৰু অলপমান ড্ৰাই ফ্ৰুটছো দিব পাৰে যদি শিশুটি আপোনাৰ 2 বছৰৰ ওপৰত। গতিকে অলপ সাৱধান হ'ব, কাৰণ ড্ৰাই ফ্ৰুটছবিলাক সৰু হয়, কেতিয়াবা সেইটো ডিঙিত লাগি ধৰে। গতিকে সেইটো তেনেকুৱা ধৰণৰ অসুবিধা যাতে নহয় সেইটো চাব লাগিব। গতিকে এইখিনি যদি খাদ্য খায়, আৰু শিশুটি আজিকালি আমাৰ চহৰত কি হৈছে যে খেলা ধূলা কমি গৈছে, পৰিশ্ৰম যদি নাথাকে শৰীৰত, তেতিয়া শৰীৰটোৰ ইমিউন ছিষ্টেমটো উইক হৈ যায়। গতিকে সেই পৰিশ্ৰমখিনি হ'বৰ কাৰণে তাক খেলা ধূলা 1 ঘণ্টাৰ কাৰণে যাতে হৈছে সেই কথাটো চাব। আৰু ক্ৰাউডেড প্লেচেছ এৰি চলিব। আৰু কোভিডৰ কাৰণে যোনখিনি নিৰ্দেশনালী আমাক গভৰ্ণমেণ্টে দিছে সেইখিনি মানি চলিব যদি এইখিনি বস্তু কৰে মই ভাবোঁ যে আপোনাৰ শিশুটি খালি কোভিড বুলিয়ে নহয় সব ধৰণৰ ভাইৰেল ইনফেকশ্যনৰ পৰা বাচি থাকিব পাৰিব
All right, thank you so much for calling at this point in time. Very important points you have mentioned, doctor, because a lot of parents are really concerned if a children is cured from COVID or is suffering from COVID. So what has to be done and what not has to be done. So, doctor, let's talk about sore throat. That is also a very common illness seen in children.
Right. See, sore throat is a disease where your throat, the part behind your tongue, which is the pharynx and the larynx, gets involved. So the symptoms normally you will have when you have sore throat, it will be fever, then some itchiness in the throat, and which might lead to pain while swallowing food or water or anything, or sometimes if it is very severe kind of sore throat, you might have severe discomfort and severe pain even when you are not eating.
Okay.
So these are the main symptoms. When you examine if it is a bacterial infection causing in the throat, many times you will see pus points on the tonsils or on the pharynx, or you might see membranes, white kind of patches on the tonsils or in the pharynx. So those will give us a lead as to what kind of sore throat we are dealing with. But commonly seen sore throats are mostly because of virus, where you say that the throat is the palate and the throat and the tonsils look little red. It might be little swollen also. And if the child is not very toxic, then you don't really require an antibiotic.
Okay.
It is like common cold. It is more severe than common cold, but then with paracetamol, adequate amount of hydration, which means lot of water and liquid things to be given to the child, and with good food, the child will, and good rest, child will recover in 5 to 7 days.
Okay.
But if it is bacterial, then the child will look toxic. And the commonest organism which causes sore throat is something called streptococcus, and it is a very serious kind of bug because it can lead to some complications in the heart or even in the kidneys. So previously, when there were not good antibiotics, we used to have lot of children in my medical days. In my MBBS days, I used to see that lot of children with streptococcus sore throat used to land up with kidney and heart problems.
Okay.
But
so one has to be very careful whenever they see that the sore throat kind of symptom is seen in children.
Severe, If you have severe kind of sore throat, then immediate antibiotic.
It should not be ignored.
And we can do a culture of from the throat, like a throat swab culture, and we can identify the organism easily. And proper antibiotic given on time will take care of the disease on time without leading to complications.
All right.
So this is one. And then the other common illnesses that you have in the winter is some children go through ear infections.
Ear infections.
Because common cold is very common in children, and winter, where the ear, we have a passage through the nose to the ear, which is called eustachian tube. That gets clogged easily, and that leads to ear infection. So sometimes it is difficult to identify this on time in a small child, but usually the child will be very, very irritable. He will have
so those might be the symptoms that the parents might come to know that something is wrong with the children, and they should immediately go and see a pediatrician. Doctor, we are really short of time, so we have to wrap up this show at this point in time. All right, viewers, with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.